Okay, so now I've just dismissed my patient and I want to show you what to do when you return to your operatory and what the proper procedure is to break down your chair. So the first thing you want to do is get your PPE back on, full PPE. Okay, so now the first step in breaking down your chair after you get your PPE on is we want to get the contaminated instruments back to sterilization. So we want you to pick up your whole tray. So you're not handling loose instruments in your hand like this. You have the potential to poke yourself, for one, but maybe drop it and damage the instrument. So it's safest if you just take your whole tray. Okay. And this is Dr. Ryan's window. Now you can take your instruments off your tray and place them onto the blue tray, and now you can go back to your chair. When you return to your chair, you can go ahead and put your tray back on your bracket table, and now it's time to remove the barriers. The first thing I like to do is take my chair cover, and I like to place all the rest of my barriers in it. So I just kind of use it as like a little sack like that. So I'm going to take off my barrier tape that's on my light. Going to remove the barrier and air water syringe tip. I'll press this outer ring, whoops, so it releases. I can take the cover off of my tray. This is all going to get wiped down with our disinfecting wipes. And I can remove the barrier off the control panel. I'm just gonna place it here in this bag. Take the barriers off the sides of my cart. This barrier has been laminated so it can be wiped down with our disinfecting wipes. Because I folded over this blue barrier tape, it's so easy to remove the tape from the pen. If you don't fold it over, then you could sit here and wrestle with this pen for a long time removing that tape. Now I cannot forget to remove the barrier tape off of the handle from my chair. Lastly, I have my saliva ejector. Barrier comes off, saliva ejector is disposable. Okay, now this whole bag can go right in the garbage. Now that we've removed all of our barriers, now it's time to flush our water lines. If you are in morning clinic, that means in the afternoon, a different student is going to be using your chair to see a patient. So you want to flush your water lines for 2 minutes. You'll take both air water syringes and you're going to turn on your high volume section, okay? That's the larger, it's larger than your saliva ejector. You're gonna turn on your high volume section. You can place it back into the arm. And then you're going to purge the water from both syringes for 2 minutes. If you are the last clinician of the day, then you're going to use a water line cleaner called Solmedix. The water line cleaner should be found at the end of every counter under the sink. I don't want to contaminate the handles of the cabinets, so I'm going to take off one glove, open the handle, and these are considered contaminated. So I'm going to grab this unit and then the solution here. And I'm going to place them on the counter. Now I can take my clean hand, close the cabinet door, throw the glove away. I'm going to get one more glove. Okay, so we're going to take the cap off of the empty bottle, and we need 1 ounce of this solution. So there's a 1 right there. I wonder why that's not working. Oh, there we go. Okay, 1 ounce. All right, so I've just poured 1 ounce of the Solmedix Power Scrub line cleaner into the bottle. Now, I'm just going to do 1 operatory. So now I need to fill the water up to this 1,000 milliliter line. If you're doing 2 operatories, then you can do 2 ounces of the Solmedix and fill water up to the 2,000 milliliter line. But I'm just doing 1, so I'm gonna fill the water up to here. Okay, so now I have water filled up to the 1,000 milliliter line, and I've got my 1 ounce of my Solmedix in the container as well. I'm gonna put the the cap back on, and then now I'm going to connect this to my high volume suction and my saliva ejector. And so the high volume suction and the saliva ejector are going to be cleaned by this line cleaner, and this is done at the end of each day. Okay, so now I've just cleaned my water lines. Now it's time for me to disinfect my chair. This is where you're going to find your sharps container and your disinfecting wipes. You want to make sure to get enough wipes so you have 1 or 2 wipes in each hand. The first thing I need to do is wipe down the counter area. These are the bottles that I just used to clean my water lines, and I contaminated them. So I'm wiping them down. I'm holding this wipe in my hand so I'm not recontaminating the handle. And now I'm going to just wipe this outer handle just to make sure it stays clean. Putting those away, just like so. Going to come around, clean the whole counter space, including the sides, clean the knob here, anything that was possibly touched. These wipes are safe to use on the upholstery, on the chairs. You're going to be wiping the arm. You're going to be wiping all the tubes. The reason for having a wipe in each hand, you don't want to wipe something down and then grab it with your contaminated gloves and put it away afterwards. Then you've recontaminated it. 1 or 2 wipes in each hand. I always turn the suction off and on. You want to clean in between the little threadings in the arm because you can have lots of microorganisms or infectious material that gets stuck in those areas. So you're going to do this with each one. Even if you didn't use all of these, you still need to wipe them down because you may have inadvertently touched them when you moved the arm. Okay, now I'm going to clean the stool and any part that was touched. See how I'm moving them back into place by holding onto the stool only with the disinfecting wipes. I'm going to wipe down my pen, place it on the counter. Wiping my barrier, placing it back in to the drawer, wiping along the sides. Now I'm going to move my cart back. Going to wipe my light and then position it so the light handle is resting on this upper arm. Wiping my bracket table. Always take your tray off so you can clean underneath it, and you're holding the edges of your tray with the disinfecting wipes. Okay, and then wiping all the hoses on your bracket table. The more that you do this, practice makes perfect. You're going to develop a system so you can do this very quickly and efficiently, and you'll probably follow the same sequence every time you clean a chair or an op, so that way you don't forget what you've already cleaned and what you haven't cleaned yet. Last thing I do is the chair. And we want to do the back of the chair, the armrests, and then the base of the chair, including where the patient sits. Okay, now I'm going to move my bracket table so it's right over my chair like so. And I need to move the pedals onto the base of the chair. So I'm going to take my rheostat here, move it to the base of the chair. Now this is for the ultrasonic, and this is plugged in. It can go right on the base of the chair as well, and you can just leave it plugged in. If you notice anything that looks kind of dirty on the bottom of the chair, please wipe it. If you notice anything on the actual base of the chair on the floor, please wipe it down. Sometimes, dust or hair or polishing paste can get down here. And a little goes a long way when everybody does their part each day. Okay, now that I've got everything assembled, the last step is removing your PPE. Gloves come off first in the garbage. Now I remove my gown. This goes to the dirty laundry, which is over by sterilization. I'll show you where it is. This is where contaminated laundry goes. So your gowns will go in the top baskets. If you used any towels or blankets for your patients, then those go in the bottom bins, which are labeled towels, blankets. Okay, now that I'm back at my chair, I'm just checking everything over to make sure my chair looks the way I know it should. My chair needs to be up. My bracket table needs to be over my chair. My light needs to be in a position where the handle is resting on the arm. My rheostats need to be on the base. The last thing is to make sure your chairs are positioned at the back of the chair. Now, before I leave, I need to take off my eyewear, take off my mask, throw it away, and then I can sanitize. I can either wash my hands or I can sanitize with a little bit of sanitizer. And that's it.